Public health on the brink, the unfolding public health crisis in the US and beyond. Health is on the chopping block in the US and worldwide. Federal funding cuts, global health funding cuts, jobs being lost, health being drastically impacted. It's been a rough few weeks for many of you, and that's to say the least. Let me give you some perspective. There's a lot of damage that is happening right now. Funding freezes, confusion, and no clarity on the long-term impacts of these cuts are creating uncertainty for global health workers, public health workers, researchers, and the communities that rely most on these services. The scale of these cuts is historic, affecting both domestic and global health programs, from layoffs at the CDC and NIH to halted funding for HIV/AIDS treatment and prevention programs in Africa. These decisions jeopardize millions of lives. Congress's role and the need for advocacy. Congress plays a critical role in determining funding levels for public health and global health programs. In addition to setting budget allocation, Congress also establishes policy provisions and restrictions that A. direct how funds are spent, example, earmarks for the specific programs like PEPFAR, B. determine which organizations receive funding, an example, restrictions on who can access federal dollars, and C. shape the scope and implementation of public health and global health activities. These funding decisions directly impact life-saving programs, and advocacy is crucial right now. Policymakers must hear from public health professionals, researchers, and affected communities to protect the infrastructure that supports millions of people in the US and beyond. If you're interested in joining advocacy efforts, check out the National Alliance of Public Health Students and Alums. I'll leave a link below. Federal impact. Thousands of public health jobs have been cut, leaving many professionals unemployed. This impact on the domestic health programs is profound. Firstly, Medicaid. Republican leaders have proposed reducing federal Medicaid funding by $1.5 to $2 trillion, introducing stricter work requirements and lifetime benefit caps. Their proposals also eliminates the 90% federal match rate for the Affordable Care Act expansion. These proposals could end health coverage for 20 million Americans. These changes could have huge impacts for low-income communities who already face significant health inequities. RFK Jr.'s impact on the NIH and federal health policy. Robert Kennedy Jr., the new U.S. Secretary of Health and Human Services, has positioned himself as an opponent of traditional public health policies, particularly in vaccines and federal research funding. If he gains more political influence, we can see diverted NIH funding towards alternative health initiatives with limited scientific backing, weakened vaccine research and potential funding cuts for infectious disease prevention and research, and disruptions in scientific collaboration that are essential for developing future medical breakthroughs. I will note that Secretary Kennedy's prioritization of chronic disease and lifestyle health interventions could have some positive impacts, but this goes without saying that the negative impacts can be tremendous. The National Institute of Health, or NIH. The NIH has faced a suspension of grant funding, freezing much of its $47 billion budget. This is happening despite multiple lawsuits challenging the executive orders. The meeting freezes has stalled over 16,000 grant applications, delaying an estimated $1.5 billion in funding for critical research. New policies have capped indirect research costs at 15%, down from 30 to 70%, putting research institutions at financial risk, leading to widespread layoffs and halted research projects. Additionally, these cuts could discourage young scientists from entering the field and pushing existing experts to leave the U.S., further weakening the U.S. research and public health landscape. The Center for Disease Control and Prevention, or the CDC. A proposed $1.8 billion cut, approximately 22% of the CDC's budget, is under consideration. Major public health coalitions, including the Big City Health Coalition, have pushed back against these cuts. This reduction threatens essential programs, including the potential elimination of the National Center for Injury Prevention and Control, which addresses suicide and overdose prevention. Public health emergency response capabilities would be significantly weakened, and these cuts may discourage professionals from pursuing careers at the CDC. The Department of Health and Human Services, or HHS. Significant job cuts are underway. Reports indicate that as many as 5,200 probationary employees across HHS could be dismissed. These cuts affect various agencies under HHS, including the CDC, NIH, and the Food and Drug Administration, and could undermine public health programs and threaten emergency response efforts. HHS Secretary Kennedy has suggested shifting the agency's focus away from infectious disease and instead prioritize chronic disease and lifestyle health interventions, a shift that could weaken the nation's pandemic preparedness. Shifting to global impacts and a lens on AIDS, the U.S. has historically been the largest single donor to global health programs, funding initiatives related to HIV/AIDS, malaria, maternal health, and emergency response, to name a few. Less than 0.1% of the U.S. federal budget, or $12.4 billion, goes towards global health efforts. While this may seem small, these funds are critical for community-based organizations that fight some of the world's toughest health challenges. However, recent USAID and global health budget cuts have already caused major disruptions. HIV/AIDS and PEPFAR funding is at risk. PEPFAR, or the President's Emergency Plan for AIDS Relief, has been a cornerstone of the U.S. global health funding, contributing to saving over 25 million lives since its inception. U.S. budget cuts threaten essential HIV/AIDS prevention and treatment programs, which have played a crucial role in curbing the epidemic, particularly in sub-Saharan Africa. Without continued support, decades of progress in reducing HIV transmission rates could be reversed, leading to more infections and millions of preventable deaths. USAID and international humanitarian assistance. The sudden suspension of U.S. foreign aid has already forced organizations like the International Rescue Committee, Catholic Relief Services, and Norwegian Refugee Council to downsize or shut down key operations. Programs in Africa, Latin America, and the Middle East, USAID-supported projects focused on food security, education, maternal health, and infectious disease prevention are being discontinued, leaving millions of people vulnerable to worsening conditions. Experts warn that cuts to U.S. global health assistance could result in preventable deaths as underfunded health systems in low and middle income countries struggle to cope. And if you're interested in other projects that have been affected by these AIDS cuts, check out the link below. How foreign aid cuts affect the world's poorest. The U.S. is the largest global health donor, funding HIV/AIDS treatment, maternal and child health, tuberculosis, malaria, nutrition, and more. Cuts to these programs could worsen global health crises and increase preventable deaths. Some of the programs that are at risk: HIV and AIDS. 50% of U.S. global health funding goes to support this, and reductions to PEPFAR threatens millions of lives. Maternal and child health programs. Cuts could lead to higher maternal and infant deaths worldwide. Tuberculosis and malaria programs. Drug shortages and halted prevention efforts risk resurgences of deadly diseases. Nutrition and family planning programs. More children can face malnutrition and stunted growth, while reduced reproduction health funding could increase unintended pregnancies. And global health security programs. Cuts weaken pandemic preparedness, raising global health outbreak risk. Without U.S. funding, we can face higher child and maternal mortality, resurgences of infectious diseases, weaker health systems leading to pandemic risk, and increased poverty, hunger, and instability. With less than 0.01% of the U.S. budget supporting global health, these cuts could undo decades of progress and cost millions of lives. Will these organizations recover? Given the economic downturn, global inflation, and weakened donor commitments, many of these organizations may struggle to fully recover, even if funding is restored in the future. The loss of experienced personnel due to mass layoffs will make it difficult to rebuild institutional capacity. Other wealthy nations and private donors are unlikely to fill the gap, as they face their own economic constraints given the global financial landscape. However, this could allow countries like China and Russia to step in and fill the gap in funding and gaining greater influence in the global health leadership. The damage to research infrastructure and international collaboration efforts could take years, if not decades, to repair. Looking ahead, it seems pretty bleak right now, but this is the work we signed up for. Achieving health equity was already hard, and now it's even harder. I wanted to share this message. Hey public health people, I know it might feel heavy right now, but remember, this too shall pass. Every challenge you face and every battle you fight makes you stronger, sharper, and more resilient in the continuous fight against inequity. We are warriors for health, for justice, for community. We don't back down, even when we feel down. We stand together. We support each other. We lift each other up because we know that this unity is our greatest strength. Even when times are hard, take a moment to find joy in the simple things. The moments that make you smile, the connections that remind you of why you started this journey in the first place. Hold on to hope, lean on your community, and remember, you are never alone in this fight. Keep pushing, keep believing. Together, we are unstoppable. You've got this. We're in this together. That just means we have to step up even more today to advocate, to organize, and to push back. We must continue to protect the most vulnerable and marginalized populations, not just in the US, but worldwide. Conclusions. The federal budget cuts to domestic health agencies and international aid programs have created severe public health and humanitarian consequences. The CDC, NIH, Medicaid, and USAID are all experiencing historic reductions in funding, endangering both U.S. public health and global health security. With millions of lives at stake, experts warn that the repercussions of these cuts could reverse decades of progress in disease prevention, healthcare access, and humanitarian aid, with long-term consequences that may be difficult, if not impossible, to undo. Final thoughts? Take care of yourself, support your community, be kind, stay resilient, and allow the serendipity to flow your way. If you've been looking for a place to connect, join our free community below. And if you're looking for some one-on-one personalized coaching to support you in your career growth, I do have some paid sessions below. Click the link. Look forward to connecting with you all soon. Hit that like button if you enjoyed this video and share it with someone who gets some value from it. There's a problem with news and bias. Staying informed about public health and other health-related topics is harder than ever. Depending on where you get your news, you might not even hear about critical stories, or you might only get one side of the narrative. Take this recent case. A federal judge temporarily blocked plans that would have cut billions in research funding. But here's the catch. Right-leaning outlets might frame this as an attack on cost-cutting, while left-leaning outlets emphasize the dangers of slashing health research. Some media barely covers it at all. That's why I use GroundNews. GroundNews is an app and website that lets you see how different media outlets cover the same story, helping you cut through the bias and get the full picture of the issue. Compare coverage across thousands of news sources, see each outlet's political bias and reliability, discover who owns the media you're reading, and use the blind spot feature to find stories underreported by one side of the spectrum. I've been using GroundNews to track important public health stories and to avoid falling into one-sided narratives. It helps me to think critically about what's being exaggerated, sensationalized, or ignored. GroundNews is offering 40% off its Vantage plan. If you click the link below, you can go to GroundNews and get 40% off their Vantage plan, which is the one that I use. Your subscription not only keeps you informed, but it also supports making the media landscape more transparent. Check out news today and stay fully informed. Click the link in the bio below.